Rowing is a closed chain exercise. In this first part, the erector spinae muscles of the back are relaxed, which allows the abdominals to flex the trunk. The sartorius muscle rotates the thighs, which allows the body to flex between the thighs to obtain maximum reach. The hamstrings and the gastrocnemius are contracting while the knees are in flexion. The quadriceps are elongated and stretched. The rectus femoris is allowing for hip flexion. The ankles are dorsiflexed by the tibialis anterior, and the elbows are extended by the triceps brachii. In this second part, the quadriceps extend the knee, and the feet are plantar flexed by the soleus and the gastrocnemius muscles. The lower back is supported by different muscles. The shoulder muscles, supraspinatus, infraspinatus, subscapularis, teres major and minor, and the biceps brachii are all contracting. The scapula, which is protracted, is stabilized by the serratus anterior and the trapezius muscles. As the knees are finishing their extension, the femur rolls and glides in the knee joint along the tibia. The hip is also extending by the gluteus and hamstring muscles. During this, the concave glenoid fossa articulates with the convex humeral head. Back extension is occurring by the contraction of the erector spinae. In the upper body, elbow flexion is occurring by the biceps, brachialis, and the brachioradialis muscles. The knees are maximally extended and the ankles are plantar flexed. In addition, hip and back extension are being completed. The flexor and extensor carpi ulnaris muscles of the forearm contract to stabilize and adduct the wrist. The shoulder is extended and adducted. The upper arm is internally rotated by the latissimus dorsi and pectoralis major. The teres minor, posterior deltoid, and the long head of the biceps are acting on the shoulder joint. The scapula is rotated downward by the pectoralis minor and then drawn backward by the trapezius and rhomboid muscles. In this third part, the knees and ankles remain constant as the hips complete a full extension. The back extensors are continually contracting and the upper arms are internally rotated from the latissimus dorsi contracting. The triceps are extending the elbows slightly. The head of the humerus glides anteriorly in the shoulder joint. In this fourth part and the end, the arms are pushed forward and away from the body by the triceps until the elbows reach full extension. The humerus glides posteriorly in the shoulder joint as the arm is in flexion. The coracobrachialis and biceps contract, and the upper arms raise slightly as they pass over the extended knees. The abdominals flex the torso, and the hands have cleared the extended knees. The ankle is dorsiflexion, and the hip and knee are in flexion. After this, the rower starts the cycle all over again.